Hi, I'm Enchanting Nubianette. Welcome back. And if you're viewing my channel for the very first time, welcome. In the Bronx, a 62-year-old home health aide was recovering after police said she was poked. I can't say the actual word on YouTube. Dozens of times inside her patient's Longwood section apartment. The culprit is a woman's psychotic grandson who was taken into custody at the scene. I'm sharing this news story that took place years ago because a home health aide and additional professions where employees must enter clients' homes are easy to qualify for and obtain jobs, but they can be quite dangerous. Going back to the story, the late afternoon attack unfolded on Sunday, July 29th in 2018, inside 1131 West Farms Road, a senior housing building. All of the neighbors were left shaken as they watched the victim, Maria Rios, the home health aide, who staggered in red. She was soaked in it. She managed to stumble into the hallway begging for help. Going back, at first, it was a quiet visit, but moments after being let in, Marcus Gomez, horrible, horrible man, allegedly grabbed a kitchen object rhymed with wife. This madman launched a vicious assault, poking Miss Rios about 40 times in the head, chest, and face. Everyone, I can't even imagine the pain that Miss Rios experienced, nor the shock that her neighbor Diane Waterman and others felt seeing this brutality. The vicious attack could have been prevented if only the agency gave the home health aide information about the woman's grandson prior to taking this case. Why was Miss Rios put in this vulnerable predicament without having the information or resources to protect herself and her patient? Now let's get back to the news story. Thankfully, Ms. Waterman and another neighbor swiftly assisted Miss Rios to keep her calm. Perhaps they applied pressure to some of the wounds, etc. The detective said one thrust missed her heart by barely a centimeter. According to investigators, the aide, Maria Rios, had just finished tending to her 90-year-old client who suffered from dementia when Marcus Gomez, who was 45, arrived unannounced. Moments after being let in, Marcus Gomez turned violent. Marcus Gomez allegedly grabbed a kitchen object, rhymes with wife, as I mentioned before, and launched this frenzied assault. Everyone, there was a horror scene in the hallway. Building surveillance footage later released to the media, it showed that Miss Rios was stumbling from the apartment, which was 3F. Her scrubs was drenched in red, and she was pounding on doors in a desperate search for someone to help her. In quotes, it says online, "I was scared to death, but I needed to help her," recalled neighbor Diane Waterman, who along with Maria Guardiola rushed to her side while dialing 911. Miss Guardiola remembers the shock of seeing the home health aide's injuries. She said in quotes, "She was poked so many times and the red liquid was just pouring out of her chest." Well, she didn't say red liquid, but you know, everyone, I cannot say the word on YouTube. Again, the red was pouring out of her chest, she told reporters. Over and over, Miss Guardiola added that she urged the home health aide to still live, don't move, end of quotes. Now, despite the brutal attack, Mrs. Rios remained conscious long enough to identify her attacker. She told Diane Waterman that Marcus Gomez had warned, "If I touch his grandmother again, I'm going to transition you." That's exactly what he said, moments before plunging the sharp kitchen object. And again, I'm using transition instead of the other word, the K word. EMTs rushed to Miss Rios and they got her to Lincoln Hospital. Miraculously, the surgeon said her chances for a full recovery were, in quote, remarkably good, given the severity of her wounds. Now I'm going to share some details about the suspect or the troubled grandson. Police said that Marcus Gomez listed Creedmoor Psychiatric Center in Queens as his residence. I'm not sure if he was formally admitted there. Perhaps he was. Several neighbors described the suspect as disoriented when officers arrived. Marcus Gomez, he was wearing what looked like one of his grandmother's nightgowns, and he had changed out of the red soaked clothes. Now, in all of his craziness, he still was able to know that he should change his clothes. You see that? It's so unfortunate that Marcus Gomez was able to even, go to the apartment. You know, he had that focus to even visit his grandmother. His diagnosis, whatever it is, evidently severe, he should not have been able to interact with the general public without any supervision. Let's continue. Inside the apartment, officers found his 90-year-old grandmother sitting at a table, unaware of the catastrophic incident, still playing dominoes with red splatter all over the tiles. Thankfully, she was uninjured. Then Marcus Gomez was escorted out in handcuffs, and at that time, he was undergoing a court ordered psychiatric evaluation. So he faced 3 counts of assault, criminal possession of a weapon, and harassment. Prosecutors said additional charges would follow pending Ms. Rios' long-term prognosis. Well, that attack reignited concerns among New York's 180,000 home care workers, who often enter private residences alone. Union officials were again pressing Albany to pass solo worker panic alert legislation, which had been stalled since 2016, while the State Office of Mental Health was reviewing policies on tracking psychiatric patients who leave residential facilities for unsupervised visits. His should not have been supervised. Excuse me, his should have been supervised. I don't know why I said that. It should not have been allowed. Excuse me. Good news is, yes, there are panic alarm solutions designed for lone workers in New York City now, both for specific injuries and general use. These solutions can range from wearable devices to mobile apps, and they offer one-button alerts, GPS tracking, and communication options. The Assembly Bill, letter A 7833, this law aims to protect social service employees working alone by requiring them to have panic buttons. There's also Retail Worker Safety Act. This act, it's a New York State law which requires retail businesses with 500 or more employees nationwide to provide panic alarms to their New York-based employees. I think it should be even if you have 5 workers. There's also a bodega panic buttons. So following the tragic unaliving of Lisandro Jr. Guzman Velez, the city invested in panic buttons for bodegas to enhance safety. And these buttons are part of the Silent Shield system. So it directly connects to police to store surveillance, improving response times and providing situational awareness. And everyone, there's tons of comments by people who work in homes. Many of them prefer not to even have family members visit while they're working with the patient. So everyone, I'm going to wrap this up because it's a long video, but thank you so much for watching. Please remember to like, share, and even comment and subscribe to my channel. Stay safe wherever you are.